Well, we are here at the Vein Company, their office in Kingsport, talking today about vein disease and how important it is to get it treated. And we are here with Dr. Randall Towne. And Dr. Towne, thanks so much for having us out today.
Oh, you're more than welcome. Thank you.
I'm learning so much about vein disease and the treatment options that are available. First of all, tell me a little bit about the Vein Company. You guys have been here for a few years now.
Yeah, we've been established for the last 3 years. We have offices in Johnson City, Kingsport, Knoxville, Sevierville, adding one in Abington, Virginia.
So continuing to expand and continuing to meet a need in our community. Tell me a little bit about what you treat here.
Vein disease is often misunderstood, misdiagnosed disorder. When you think of the vein system, you want to think of a group of blood vessels that return blood flow back to the heart. So any abnormality on that return in blood flow is embraced as venous disease. The risk factors tend to be a combination of age, gender play a role, obesity, multiple pregnancies, previous surgeries, operations, trauma, blood clots, all contribute to these changes that occur in the vein systems, predominantly on the lower extremity.
And you mentioned kind of misunderstood, mistreated. A lot of people, when they think about their veins, they think about cosmetic. Oh, it looks bad. But it's a medical condition that can have just an unbelievable effect.
Oh, it's an incredibly important disorder. It affects well over 80% of the U.S. population, some of which manifest with minor changes. Skin spiders, which are these surface vessels that are cosmetically managed. We manage the more complex disorders. Those are associated with ulcerations, marked pigmentation changes, and it contributes to disability, in particular among our senior population.
You said a lot of your patients will come in and they are barely able to walk.
Yes, a number of our folks, when they come in, they have significant physical limitations. They often have bandages on the lower extremity. They have opened ulcerations that have not been addressed appropriately. And this can contribute to limb loss if they're not careful.
And you have multiple different sort of treatments for the patients when they come in that can make a world of difference.
Yeah, there are numerous treatment modalities, most successful of which is something referred to as radio frequency ablation. It's an office-based catheter procedure that's state-of-the-art and really facilitates the improvement and the correction of this underlying disorder.
And I would imagine for someone that can come in barely able to walk, who's been living with this and watching sort of that deterioration, you're able to really change their life.
Oh, we have a significant impact on their outcomes. And it requires a dedicated team with the use of ultrasonography, a non-invasive modality that identifies the underlying disease process, skilled sonographers, nurse practitioners, and a collective group of physicians who specifically address this. But the outcome is incredibly beneficial in the long term.
And it's a medical procedure, so a lot of times people don't realize, but insurance and things like that, it's covered.
It's covered by Medicare and all commercial health providers because they've recognized it is so ubiquitous and so commonplace. And as they say, misunderstood and often overlooked and dismissed.
So your advice to people out there who may be watching this saying, wow, this is something that I could change, that I could see an improvement.
Yeah, by all means. Any individuals who present with chronic lower leg pain, heaviness, discomfort, burning, a sense of irritability, neuropathies, restless leg syndrome, any ulcerations or pigmentation changes. This is a group of patients that we address. And with the appropriate, timely management, we have a significant impact on their outcome.
Wow. And certainly exciting that you continue to grow, continue to meet the needs of the community, and getting ready to open again now in Abington.
In Abington, we anticipate office sometime in March of next year, and hopefully continue to expand.
All right, but for now, you've got offices here in Kingsport and in Johnson City. We'll give everybody the information. Certainly such an important topic. If you would like more information, it is the Vein Company. You can find them in Kingsport and Johnson City. Also, here is their website and phone numbers to call if you would like to schedule an appointment. Dr. Towne, thanks so much for joining us.
Thank you. Thank you.